is because it has the serratus anterior muscle, which can allow you to laterally rotate. So when I do this, in order to hyper-abduct, if I want to comb my hair, I need the serratus anterior muscle to allow me to hyper-abduct, and I can touch my back, right? Because my scapula is rotated laterally at this point. Can anybody tell me what nerve innervates the serratus anterior? It's the long thoracic nerve. Remember when we talk about wing scapular? It makes sense because if the muscle has to stabilize this, right? Stabilize the scapula down. If it gets injured, this scapula will be protracted, right? It will be retracted backwards, and you won't be able to hyper-abduct, and you get what? A wing scapula. Because when you push against the wall, when I tell Bob to push against the wall, if there's nothing to hold this guy down, this thing is going to pop out, and it's going to look like a wing. All right? Just quick clinical, practical application. So I left off at abduction. Now we have to adduct. I haven't talked about the anterior muscle, which is our pecs, right? Everybody knows the big pecs muscles. But there's a mnemonic for the pecs. Think about pecs as your fam. You know, family members, they sort of kind of put their pecs on your chest, right? That's how I think about it. So pec is my fam. What does fam stand for? F as in flexion, A as in adduction, M as in medial rotation. I've given you two answers. You know three functions of the muscle already. Now, pec is your fam. So now, if I ask you, what are the primary adductors? Remember, pec is your fam and lats is your mill, right? So the A in the mill is for adduction. So if I tell you what helps you in adduct, your arm, the lats will help you in adduction. Also, your pectoralis major is going to help you in adduction, but those are not necessarily the primary adductors. We have muscles here at the back. The subscapularis muscle is your primary adductor because it's starting from the subscapularis fossa, innervates onto the inferior tubercle of the humerus, allows you to adduct your arm. Do not forget that. And also your lats allow you to adduct. You have your pecs also allows an adduction. Now we have two more movements to go, right, guys? So, well, I don't like his arm. It's kind of like swelling, but internal rotation of the shoulder, right, of the glenoid cavity. So when I do this, I'm internally rotating the head of my humerus. When I do this, I'm externally rotating. And put your arm on it. You know, you can feel the head. I can feel the head of my humerus moving in, and I can feel it moving out. I give you the clue. We have internal rotation. One of the internal rotators of the internal rotations, we have our pecs. Remember, it's fam, so it helps in medial rotation. Also, lats also helps an internal rotation. Don't forget that. But I didn't talk about the Teres Minor. Guess what it does? The Teres Minor, which sits in the back here. Remember, the Teres Minor starts here and go all the way to the greater tubercle. Can pull the head of the scapula outward. So your pec minor and also your infraspinatus muscle will allow you to what? Externally rotate. And it's very easy. Think. Look at that. This guy's here and the other guy's here. When they shorten, they're going to do this. And basically pull the head of your humerus outside. I think we've covered most of the muscles. Just to also reiterate, the nerve that innervates the pec minor axillary nerve, the nerve that innervates your teres major should be your the lower subscapular nerve. And also, just to reiterate, the 6 muscles, supraspinatus, infraspinatus, suprascapular nerve, also your subscapularis lower and upper subscapular nerve, and also your the deltoid is the axillary nerve. Do not forget. And I think we've covered most of the muscles, the original insertions, and I hope this was very helpful. Thank you. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you'll be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.